stopped their salary.
Through the chair. Thank you. I think the same question the Honorable Khalil is asking is the first question. And probably the CS is giving just a verbal reply that they were dismissed, they justified, the salary can be stopped. It will have been prudent if the chair could ask the CS to provide some documentation. And I thought he will come here adequately prepared with all the documentation to the House to allay the fears. On the same note, through the chair, Bwana CS, we have 101 doctors, and you're saying that you are giving the House a picture of normalcy. The picture of normalcy in terms of service delivery in the county referral hospital. These two committees under the leadership of the majority leader, and the chair of the health committee, we did an impromptu visit to the county referral hospital. And it is very wrong that the CS is saying so many of the consultants and the doctors are working. In fact, the surgical ward, the normal ward 2, that has a bed capacity of 60, we only found 2 patients. And the 2 patients had nowhere to go. We visited ward 1 with less than 10 patients, and we visited the theater where we had a weekly surgical procedures of more than 60 patients, and they are only undertaking 2 to 3 to 4 cesarean procedures for pregnant and delivering mothers. Is the CS aware that services by the consultants and MOs is completely at zero? And he's reporting to the House that there are more than 15 consultants working on emergency. Thank you.
Thank you. Thank you, Honorable Chair. Yes, as I said, we have 15 MOs working in the PGH, that's the hospital. And we have 14 consultants working on call for emergency. That's the briefing we got from the Ministry of Health yesterday through the executive. And you understand, the Honorable Member has raised issues about service delivery. That's why we feel that the doctors are not providing what's required. And that is what's pushing us to take the hard stand to stop the service. Because as much as you're entitled to picket or to strike for your rights, also the people of Garissa and the governor has obligations to provide service to them. And somebody who is sick doesn't care whether KMPDU wants internship money or whether the county government hasn't given them medical cover and so on treatment. So we need the KMPDU also to understand our position that service provision is key to every Kenyan citizen. As much as the Constitution talks about right to fair economic practices, also it talks about the right to health, and which is something the consultants and doctors of Garissa County are expected to provide to Kenyans in Garissa.
Thank you. On a serious, we want to guide you accordingly, and as much as you can take your hard stand, you must be guided by the law in place, and you cannot start with a service stoppage. I think you are inconversant with the high-tech policy in place. Service stoppage is not the first disciplinary measures that need to be taken. There are measures in place before you go to service stoppage. That is honorable. Mheshimiwa Abubakar.
Thank you, Chair. Bwana CS, there's a question I want to ask. Out of the three, one of them served on a contract for 6 years, which against the law.
Those are the doctors or medical officers who are on contract. One of them served for 6 years as contracted doctor. Is that not breach of the law in place?
Thank you, Honorable Chair. I understand. The thing is, in Garissa County or in Kenya as a country, we have many doctors. Ideally, we should have a doctor in every single sub-county hospital or single dispensary that we have. Now, the thing is, we have limited resources as a county government. We can't afford to employ so many doctors. We need them. The need is there. I told them the children's doctors should be there, especially should be there 5 kilometers apart. I wish we could achieve that, but because of lack of resources, and if I tell you this, the health department takes 53% of our workforce are from the health sector. They take 47% of our wage bill goes to health. Compared now, that's one department. We have 9 other departments, and the 47% of the wage bill is going to that single department. Last year, 2022-23, we spent about 180 million in development of infrastructure, only infrastructure development, not buying drugs or everything else for them. Our budget, I think almost 28 or 30 something of our percent of our budget goes to Department of Health. This year we're spending 380 million in infrastructure development from the Department of Health. So it's costing us a lot as a county government. And we are trying our best, but it's just a limit. We can't afford to employ doctors the way we want because we need them, but we can't afford it. Because our wage bill is high as it is, and 47% of the wage bill comes from health. So that's why you see some of them have locked up for a long time, but we have absorbed them now into permanent and pensionable, and we talk to the board. So they're in the process of absorbing all the local doctors. I think 119 of them, not doctors only, but all the health doctors who are local were to be absorbed. So we are working on them. So very soon we'll all be on permanent and pensionable.
Thank you, Honorable.
Thank you, Chair. Welcome, CS, for your first ceremony with the Garissa County Assembly. CS, I wanted to ask who supervises the consultants and the doctors at the management level? That's the first question. And in case of any disciplinary action, maybe in theater, any fault in theater, or in their job place, who sits in that disciplinary board? Thank you.
Thank you, Honorable Chair. I'll answer that question in 2 different ways. We have the Garissa County Referral Hospital. We have doctors working there. They have a CEO. It's the autonomous institution of the county government. They have the disciplinary committee chaired by the CEO and the management team there. Now, for the remainder of the county health workers who are in dispensaries or health centers outside the PGH, there's the county health management committee. And they have their own advisory, HR advisory committee, who handle discipline and promotion and all those issues.
Follow on that, CS. At what length do you normally do your promotions at the county level with the Minister of Health, the doctors? Secondly, what are the qualifications of the management team? Are they consultants or they are doctors like them? Thank you.
Thank you, Honorable Chair. The management, the county health management team, CHMT, are mainly nurses. There's, I think, one consultant, Dr. Pro, is one consultant with CHMT, and Dr. Howard, who is a consultant. So that is the county HR management team. At the PGH, the CEO is one who supervises the consultants.
Follow up on Honorable Mashide. She talked of the supervisory in terms of their work as consultants. You responded on the HR matter in terms of the normal disciplinary measures. But the questions that need to be asked such is if there is lapse in the theater. Is a senior person a consultant? Maybe the kind of operation he or she has undertaken is maybe questionable. Who is in the management? We have somebody of this equivalent or maybe a senior, and how often do they normally take that supervisory role?
Sure. Just a follow-up on the 2 questions. One CS. the county health management team has no official with medical background. Let's say clinical medicine, if I'm not wrong. Probably most of them come from the public health records and nutrition background. If a consultant undertake a procedure, probably with a Russian roulette, the consultant needs to undergo a clinical probe. And whoever sits at the county management has no technical knowledge to engage the consultant on why or what kind of a mistake he has done. Probably, on a layman's language, you pardon me, is a class, let's say a class 5 dropout asking somebody with a master's in accounting, that he has done wrong. These are somebody who knows the procedure. Probably is an EAT specialist, is an ophthalmologist, or let's say a urologist. And then here sits a health management official with the health records only, asking him why the patient died. Do you see it's not fair? And why don't we have a consultant in the health management team? Thank you.
Chair. And thank you, Chair. Bonasias, just a follow-up on the issues raised by the two honorable members. And we know at the county referral hospital there is a health management team that runs in that facility. And on the other hand, we have a health management team, the county health management team, stationed at the county headquarters that coordinates the entire management and activities of the health department. And the county health management department comprises of other cadres, and the doctors and the consultants are not represented at that supreme body that oversees and coordinates the health management issues in the county. Number two, we all live in Garissa and we are aware. And that team and the county health management team were there even since before devolution. These are people who overstayed in those positions. And Mr. CS, you don't expect to be doing the same things and get a different result. Don't you think it is high time we have a paradigm shift and have new blood at the county health management team to run the affairs of Garissa County? And as Mheshimiwa Hassan Gele has said, at the county level, those who are the managers are mostly nurses and public health officers, only those two cadres. So it is high time this committee advocate for the doctors and the consultants to be represented at that level, so that they can also advocate for the issues of the doctors and the consultants. And you know, I think it is a HR policy. And you know, people cannot overstay even more than 10 years, 5 years. And we want a reshuffle to be done. And my other question, because I just want to just finish at once. And when I see us, we were told, and when some individuals, some honorable members visited the Garissa County Referral Hospital, we were told there was a close to 49 newborn babies that were lost during this strike. 32. So 32, yeah. 20 in newborn unit and 12 in ward 5. So when you weigh the cost-benefit analysis of stopping the salaries of the doctors and losing 32 babies and instantly innocent babies, don't you think the management and the administration have blood on their hands? Because when you weigh both, losing 32 babies and stopping 16 doctors' salary, which one is more heavier?
One last one.
CS, I wanted to know your plans after even dismissing the only consultants that has delivered most of the babies in Garissa. What are your plans to replace him and even the doctors? Please tell us.
Okay, thank you, Honorable Chair. And first, I'd like to demystify these deaths that have been reported as a number of babies who have passed away. I just have some information here which I'd like to share with the members and the chair. The mortalities in Ward 5 are 10. That's now the pediatric. New unit is 20 deaths during the month of March. Deaths that have occurred during the strike period of March in Ward 5 are 3, and the new unit is 7. That's total of 10 during the strike period. And so it says total admissions since April, and the April 1st are 106 newborn unit admissions. Deaths in the newborn unit since 1st of April are 7 so far. The total number in the world today are 28 neonatals. So March we had 166 admissions in the newborn unit. Total death in March were only 20. So it's not it's not.
Thank you for the chair. I think this is one of the grave matters. I can see the CS going through his phone. But I think both chairs in the House together with some of the members, we have counter-checked in the register book at the newborn unit. If I'm not wrong, we paid a visit last week. The 22 deaths as reported by the officials of the KPDU is reflected in the register of the newborn unit. Probably the CS. I think as you make the orders for him to obey the documents, I want to urge the chairs that he comes with the register of the newborn unit to confirm that the deaths are actually what has transpired there. And probably, I'm following up on the question, the picture the county secretary wants to portray is that there is normalcy. Even these deaths have not occurred. We are eyewitnesses, and this House and the Health Committee has prepared a report after the visit in the county referral hospital. And what was to be tabled in the House is a true reflection of what is there. Patients who are even referred, probably the CS will say that they are medical officers in the sub-counties. We come from the sub-counties. We are in this House with the delegated authority of the people in the rural areas and in the sub-counties, and we can confirm that in Dadaab there is no MO, in Masalani there is no MO, in Modogashe there is no MO. Now comes the bigger picture of saying that the deaths are lower than what has transpired. And we have seen from the records that the month of March, we are not talking about April. The month of March, the deaths stand at 22. And probably, Chair, it would have been good if we talked on a legal basis of documentation. The CS should provide that letter showing that the deaths were only 2 plus 7, 9. You can come with the register of the newborn unit. You can come with the letters of dismissal so that we have proper conversation with the CS to get the true reflection and the outcome of the doctor strike on human lives. Thank you.
Thank you, Hassan. Maybe this note that the statement we read from the court is not admissible because until they provide the evidence of the same. And I hope you will give us an evidence of the same. CS. I think I'll give you time for us to respond to questions.
Thank you, Honorable Chair. I agree, but as you appreciate, I'm not a health worker, I'm not the relevant of health, I'm just a at the county level. and I just came here to shed light on these matters, as reported to me by the officers on the ground who are working in the hospital, and that is what I assume to be the fact. If the committee needs documentary evidence, I can provide that by next week, or any issues. But saying, as one Roman has said through the chair, one death is too many. We're talking about 20 or 22 babies here, like we're talking about potatoes or cats dying, just buying from the market potatoes is wrong. One death is too many. And it really pains me that we're losing babies at that rate in Garissa hospital, because it's more of a cemetery than somewhere where you treat patients or babies. Saying that, also we have issues of botched operations. I remember there's 2 cases, one went to University TV and all these things, and it's something the government has taken into heart, and we're trying to rectify, especially the biggest problem we're having with the hospital is auditing of death. When death occurs, it must be audited. We must have people auditing why it happened, where things went wrong. And we have operations where, I'm sorry to say, but the doctors we have, I just sometimes wonder, because it's no way you can operate with a patient. There's something wrong, they come back to you again, you operate with them again, second time, you do more wrong, third time you come, you do more wrong. And sometimes, a few weeks ago, we lost a lady, I think, who had 3 operations in Garissa. She was referred to Coptic Hospital in Nairobi, and she passed away there, unfortunately. And it's just sad, because I even asked, me and the governor, we talked about it, and we even asked the Ministry of Health, who can audit these things? Because the doctors, I'm sorry to say, members are here for KMDU, but they're very good in covering themselves. They will tell you it was it was complications. What's complication? If I operate with somebody and I make a mistake, I don't come back again to the same operation. I'll go to somebody who's superior to me, more experienced than me, and then they come up and look with me and help me in this situation. But it's not. Unfortunately, our consultants in the hospital, we have a big issue here. I have to admit that in front of this house and this committee, that we have issues with our hospitals. The first question is, we have 39 PGH. Do we need all of them? I can give you a breakdown of what we have here. We have gynecologists, ophthalmologists. I have the whole list here. I can give you each cadre. But we just wonder, because the 2 ladies who lost their life through botched operations, and I'm told that is complication, that's the excuse they use, it's not wrong. I mean, we live in other part of the world, and we know how medical operations happen, and when something goes wrong, there's exceptional carry out, what happened, but here, it's just like, okay, it's not. God is there, yes, but you've got talent. The doctor do their best to make sure these patients survive. And in most cases, I say no, because when they go to hospitals in Nairobi, they say, even the case in Coptic, the lady was found to Coptic who passed away, the Coptic person said they can give them full report and they can sue the hospital or Garissa County for the botched operations. So it's really unfair, and that's why sometimes you see me and the governor will take hard stance against our doctors and consultants. Thank you.
Thank you.
Through the chair. So, CS, are you saying the consultants and the MOs you are talking about are incompetent? And if yes, we want value for money. And CS, it will be very unfair when you generalize the entire consultants as being not able to undertake their duties. So, if there are individuals who are not competent enough to undertake whatever they are employed to do, why can't the county government not taking disciplinary action, including dismissal, instead of generalizing? Number 2, you have not answered my question. Do you think the county health management team are not playing their role in undertaking and coordinating and supervising the Garissa County Referral Hospital?
Thank you. Just to add on the last point, I think most of the members have asked that that question. We have consultants who are doing the operations. Are there management or a superior team who supervises if there is any lapse? In your assertion, you are not very clear on that. Thank you.
Okay, thank you, Honorable Chair. I'm not sure how Because that's why I said, like I mentioned earlier, I said, I was even asking, does the Ministry of Health, Ministry of Health have an audit committee on hospitals? You can send them here to Garissa, you can audit it for us. Because when deaths happen, it's a serious matter. And who investigates them? I don't know. I asked the director for help. I was not clear on how to investigate death, how to audit death. And it's true, as I remember, she said, Khadija said, the CHUT is composed of public health and more nurses than doctor consultants. But I have to be frank here. You know, I don't want to miss my words with the consultants and the doctors. They're very, very good in covering themselves. They cover for each other. That's the reality of the matter. Because we have consultants who are health consultants. These consultants and doctors work in the private sector. Today I'm your boss here, tomorrow I go out there, you're my boss. So I can't say anything to you. That's why things are going wrong in the hospital of Garissa. Because I am a supervisor here in this situation, I'm your boss here, but when you go out there to a clinic, you're my boss. Maybe you own a clinic and I work for you privately. And that is the biggest problem we are having. For example, we started with the health department, with the governor and the deputy governor, and we asked them a question. How many consultants do you have? 39 in the PGH. They gave us the breakdown. Gynecology 6. I have the list here. Gynecology list 6. Ophthalmologists, radiologists, oncologists. They give us the list of every cadre that they have. So I asked the CEO, gynecologist, what do they do? They treat women, pregnancy, all these things. How many do you have in the hospital? She said, I have 6. Okay. How many active duty working for you? She said 5. Where's the other one? She said, not. So I just told her, today I'm a consultant gynecologist. I come to work. How do I don't know, I'm not a medical worker, I'm not a health worker. Just go through with me a day as a gynecologist. What do you do? She said, oh, one of them will go to the wards, do ward round, another will do surgeries, another will go see our patients. I told her, okay, assume today I'm a gynecologist and I'm assigned to do ward rounds. What time do I start work? She told me start around 8 o'clock. What do? Go around see patients until what time? Until 12 o'clock. That's 4 hours. What happens after 4 hours? You go home. That's it. You go home. So we are paying full time, and consultants are very expensive. We pay them 500,000 a month. They're very expensive people to maintain. We give them all this money for 4 hour a day value for work, which I said, why can they work 8 to 5 like any other person in Kenya, any other civil servant? No, they go out to the private practice. In the hospital, honorable chair, in the hospital we have brokers lined up outside the hospital in taxis. Consultants are firing them to. They say, if you come to them, they tell you, okay, I'll go to the hospital. They call their person to pick you from there. We know all these things. So there's a lot of insincerity from that aspect of also our doctors and our consultants. Unfortunately, I'm sorry to say. I'm head public service. It's a shame for me to admit this. That's the reality in Garissa County Hospital.
Point of order, Chair. Just one minute.
Just a minute before you proceed, the response is very clear that there is no committee in place in terms of supervising the consultants that we have there. And because we have this meeting with the union, and what they say is whenever a procedure, maybe there is lapse, what we normally face health coordinating committee who are not of the equivalent or superior who can know the know-how in terms of the operation. So I think we take them because instead of because you are unable to tell us if there is a committee in place. So that tells us that the allegations posed on them is flimsy until proved otherwise in terms of the operation. If there is any laxity or maybe how they conduct the operation. The other thing is when you have a meeting with the union, they say that we are more than ready to be in the hospital, but when we have the procedure, when we come out of the data, we have nowhere to sit and nowhere to rest. In terms of offices, there is no space provided for them. Sometimes the committee went to the hospital for fact-finding and they confirmed the same. There is no, I want you to also tell us about, because you told us they will be there for 4 hours and leave. Maybe what necessitates them to leave is there is no office where they can sit and maybe they can serve the client.
just for the doctors. But you see, documentary evidence makes us believe that the consultants and the doctors are doing good work. We had a session with the KMU members. They shared and statistics, unit by unit, department by department at the county referral hospital. The surgeries at the theater increased by 55% from the year 2022 to 2023. I think it was around 12,000. For the special clinic visits, I think they served 29,000, down from 18,000. And probably there was improvement in every sector managed by the consultants, from the theater, the special clinics, the radiology, and we are very happy with the work they have done. That was a document prepared by the health committee, health management team at the hospital. That was not a doctor from the, was not a document from the doctors. It was from the hospital. That the revenue has increased by 95%. Even the revenue has increased by 95%. The theater alone is collecting close to 7 million shillings in a month. And that is revenue brought by the services of the consultants. I mean, the CS is saying they are more to the private clinics and not the hospital. Probably your assertion will be more pedestrian, because here we have a document showing the statistics in 2022 and the one in 2023. Both in terms of revenue, in terms of visits, in terms of surgeries and procedures. That's one thing. The other thing, you are saying that taxis are lined up at the gate of the hospital. What risk mitigation measures have you put? Internal mechanisms. If a consultant or a doctor is working for only 4 hours and there is no action taken by the management in the hospital, Mr. CS, probably the CEO and the board and the health management team at the hospital are all failures. If you could provide the names of the doctors, the brokers at the gate, the registration number of the taxis, because what we have seen there and what you are starting is two different things. I think in the next session, Chair, we need to be more on documentation than on verbal allegations. Thank you.
Thank you. After the good direction of the same, I want to give you a chance to have a word.
Thank you, Chair. Through the Chair. Yes. I think the information we are giving is from the Department of Health. Coming from. And the information they are giving as per our physics is not true. Do you have any other reliable source apart from the CHMT that is giving you the information? Because the number of them, the committee of witness, and the one you are given by the department manager is different. And I think that someone must be lying somewhere. And most probably, the CHMT are not sincere of what they are talking about. Two, we talk of maybe doctors not doing the work as part of the work. I think we had formal and informal engagement with the doctors here as a member, and most of the information they gave us was reality on the ground, because I was the chair for the last 1.5 years. The environment they are working is not conducive. They don't have offices to sit after maybe they go around the work, and I think that is the failure of the management. If I may say, the health management committee of the state, and they should be disbanded immediately, because they have failed Ministry of Health in Garissa County, in Garissa Health Department. The other issue is, you talk of maybe director of health. As a simply as our chair for health, we know there was an acting director for health, but I don't know if we have a director for health in Garissa County, because we have not seen any advert, and I know there's a procedure for employment. When it comes to maybe directors and key officers, we never saw any adverts for director for health since the inception of this county. Thank you very much. Thank you, Honorable Chair. The first issue I would like to tackle is the issue of the Chair said about the doctors working for 4 hours maybe because they have nowhere to rest. I don't think that's an excuse enough for them not to work for 8 hours or whatever time they are allowed to work, because 4 hours for 500,000 is value for money. And I'm sorry to say, in Kenya, we have no shortage of consultants or doctors anymore. We are going the way Nigeria and Ghana have gone, or we have more doctors that we need and more consultants who are talented. We have lawyers also who are working professional sites. So we are no shortage of these doctors and consultants. So we will not allow to be hostage by consultants. And unfortunately, these specialists are the ones we train. As we are talking now, we have 28 doctors who are trained at the cuts of the country level. We don't pay their fees, but we pay their service. And they're not giving us service. They are learning and improving their skills. When they come back, we expect to get 100% of their time and give it to the county, not private practice. So 4 hours, if you ask me, as a county secretary, 4 hours for a consultant, it's not value for money for 400,000 shillings a month. That's not value for money. The issue of the education center, in our first government, we had Excellency the Governor, we created a education center, we had a center, we put TVs for them, computers, but unfortunately, second provincial government has leased the place to a private cafeteria person, so it's not come to a cafeteria, which we are trying. The other day we just told the health management team that program should be terminated. We want to activate and create a patient that I understand they need someone to rest and recuperate and maybe relax while they wait for the next task. So it's something we are working on, and this financial year we're going to put in the budget for that center to be activated. The issue, as said by Honorable through the Chair, Honorable Hassan, is about the surgeries increased and revenue pressure is increased. I would have to agree with that, but that's only for 8 hours. If the cost was to give us 8 hours, that's only for 4 hours. If they were to give us 8 hours, that revenue will double, and we'll have more services to the people, and we'll deal with more patients. So we want consultants to work more harder. I know they're working hard already, but we want them to work harder and dedicate their service to the people of Garissa County through the Garissa County Hospital.
Thank you. Yes, let me ask a follow-up question. The issue of 4 hours, you are the one who said, that's what came from the committee. You are the one who said 4 hours, whether 4 hours or 9 hours or 8 hours. It is you to provide evidence, because when a officer calls for duty, really there is an attendance sheet whether he signs in the morning and when he's leaving, signs. So we don't know whether they are around or not. We are not talking about, we are telling us the number of consultants who stays for the number of hours that's required and how many are leaving in 2 hours time or 3 hours time. That's a verbal submission from the side. If they are telling us there is a laxity from their side and they are only in the hospital for 4 hours, we are supposed to provide evidence in terms of attendance, because there must be an attendance register, a register signed by the doctor or the consultant when they reporting for duty, the time he comes for duty and the time he is leaving or she is leaving the duty. So that will be your assumption and we are really responding to that.
Just a follow-up.
Honorable Chair, on the issue of the 4 hours, it's not my assertion. That question I asked the CEO of Garissa County Hospital. She's a consultant nutrition, and that is what she is. Because I had to go to the details of, I asked her about the consultants, their cadres. I chose just on the fly a gynecologist. She told me that she has 4 in the hospital, 5, those are maternity. There's 4 remaining. I asked her to give me, in a meeting with the governor, to give me the details of the 4. They come to work today, what do they do? She gave me, one goes to the wards, one does surgery, one goes to outpatient, and I just chose the one who goes for the ward round. I said, I'm a ward round today, I'm a consultant gynecologist, how do I begin my day? Go through with me. She told me you start at 8, you go see the patients, you finish at 11, it's fine, but normally we expect them to do 4 hours, by 12 they finish and they go home, and I asked her, what happens to the other 4 hours? She couldn't answer, unfortunately.
Thank you. Thank you. That's how we say it's not from you, maybe it's from the CEO, but still that's an assumption until she comes with evidence in terms of attendance sheet. That one is not at this point.
Chair, just a follow-up, and sorry for the monopoly. On the CS, probably the national government is